So this is the Social Determinants of Health meeting for Aurora Health Alliance. In a world where I did not work for the health department, like we're going to talk about today, I am the co-chair, but mostly that has been carried by the lovely Julia Mecklenburg and the Aurora Health Alliance staff. So sincere thanks for that. They are welcoming us here today to just myself and Brandy Kramer, who I see who's with Spring Institute, to just talk a little bit about the response work as we've been involved with COVID, but as it really relates to both social determinants of health and some inequities. So I'll share my slides. So in the regular world, I am a nurse with our Access to Care program, but have been working in the response really with a lot of our partners around supporting people who need community resources. And part of that, I think, a really good framing for today and what Brandy and I are going to talk about is this great quote from the Kaiser Family Foundation in a recent report they put out on racial and ethnic disparities and others in COVID, which is really that on top of disparate health outcomes that we have, I think, probably all seen in the news and a lot that's coming out, there's a lot of analysis that well supports, not shockingly, that the economic toll on people of color is also really disparate in COVID. And that this is not a new reality of COVID, it's just something that it exacerbates, right? Things, pre-existing realities of our structural and systemic barriers that are impacted. And so that's sort of the branch and the piece that Brandy and I have been working on and where that work comes into play. And then I might close a little bit too with some of the broader policy implications beyond the somewhat case management that Brandy and I have been involved in with this. So the framing of where we get into this is if you or someone you love needed to be isolated or quarantined, or perhaps this actually applies to you, right, given how widespread COVID-19 transmission is, what would you need to stay home for at least 14 days, sometimes longer? So if you're thinking about that, would you know how to work with your employer? Would you feel comfortable talking to HR? Does the place where you work have a functioning HR? Could you get paid for that time off? Could you be protected in how and when you would come back to work and how that would happen? Would you need food or other essential items? Do you have transportation to go and get them, or a computer at home so you could order them in a social distancing safe way? Rent or utility assistance if you're missing paychecks? Are you going to be able to pay all your bills? Do you have insurance? Can you see a doctor? Could you have yourself evaluated? Could you get medical clearance if you happen to need it for something else you're doing? Shelter, not only just physically lacking it, but also, do you live in a multi-generational household, right? Where you perhaps share only a couple bathrooms and there's really no way to, have a private space for yourself, depending on how many people are in your home. And sort of anything else you could think of. Would you have all those resources, or would you need some help finding them or getting connected to them? So that's where in May of 2020, Tri-County created something called the Community Services Branch. And the goal is simply to connect people to services and support so that they can isolate and quarantine, and then hopefully help reduce the spread of COVID-19. Since the inception in May, our case managers and 3 community-based partners have reached out to more than 1,600 referrals. And we learn every day from our experiences, both to how to help individuals and to advocate for systems change. That 1,600 of the cases that have been reported by the end of October is around 5 to 10% of all the positives that were reported to us from the state health department based on people who've been tested, and also includes some contacts, their family members, et cetera. So how do they get to us? As I imagine everyone's well aware at this point, a little more with disease control processes than they used to be. If someone tests positive for COVID, or in a non-COVID world, any other reportable disease, they get a call from their local public health department asking them sort of where they could have gotten it, are they having symptoms, and providing some quarantine and isolation guidance. At the end of our interview, and this is true for many other local health departments, but not necessarily standard across the response, we ask people, do you foresee needing any community resources or supports in order to successfully stay home, including food, rent, and they give some examples. If they say yes, they're referred to the community services branch. The ideal goal is within about 1 business day or 24 hours One of our case managers then reaches out to that referral. They have an idea based on the information they got on what they might need, but they might do a further questions around how many people are in the household, how old are those people, what sort of public benefits such as WIC or SNAP or something like that might they already be connected to, or have they never been connected to those resources in their life? What are they concerned about? What extra guidance do they need, etc. And then they provide the resources, the connections across. We can talk about some examples of that. And then as time and capacity allow, follow up to make sure that the resources that they requested, they were connected to. So who are we getting referred to us? This is just a couple brief snapshots. Overwhelmingly Adams County, actually of the 3 counties that are in our jurisdiction. A little over half are Adams County, another chunk are Arapahoe, and then a little bit Douglas, and other meaning either it wasn't captured or sometimes we get like a Denver County person who's just been assigned to the wrong jurisdiction. And as you could well figure out, Aurora technically fits in all of that snapshot, but obviously heavily in Adams and Arapahoe. Around half of all of our referrals speak a language other than English. So if you can think, only 5 to 10% of any cases that are interviewed by our case investigators ask for help, but of the people asking for help, half of them are not native English speakers. Spanish is overwhelmingly our most preferred language, but Spring Institute that you'll hear from during this presentation has also received referrals for clients who speak more than another 10 languages. And that's just a ballpark. I'm sure it's more than that at this point. Here's also sort of a snapshot of what they're asking for and sort of how we've tried to categorize our support. Well, we would love to be long-term case management support. As you can imagine, 1,600 referrals from May through October does not lend itself to long-term case management. That's more than some agencies get in a year for certain services. It's really just meant to be at this moment when you were asking you to stay home, how can we support you to safely do that with other things? So, and I think it's really the best part of this graph is not so much the numbers, but blue is what people have asked for, and orange is sort of a approximation of how well we were able to meet that need. So you can see with providing guidance around employment situations, how people return to work, how they can get paid leave, we've exceeded the need, right? We've really, I think, developed some expertise there. Financial hardship, if anyone's aware of sort of how the rent and utility assistance fund have gone, we have not met the need of what's been requested. We can talk about why. For essential items like food or baby stuff needing to be delivered, especially lately, I think we've gotten really good at that. We can get people food boxes delivered to their house if they are unable to afford or navigate, for example, online grocery ordering. That's gone really well. If people are unsheltered, not so well. And then you can see sort of healthcare access and home care and some other resources. So this is one thing we're consistently trying to evaluate is what are people asking for? What needs are we able to meet, and what kinds of broader systems advocacy can we do to help meet other issues like financial hardship? So one thing would be, what can you do to help people? So just letting you know that the very basic couple pager of community resources related to especially people who have to isolate or quarantine is a public document available on our website. This is not the case management service, but all cases in the email follow-up guidance they get should get this, or if we are unable to contact them and they get a letter sent to their house, it also includes at least some basic community resource information and how to reach out if they have further questions. The other piece I would really point out is our website has guidance for employees and employers, which I think for us has become the most salient. If you see that financial piece, right, we're unable to meet lots of people's financial need because eligibility for financial programs can be complex. Not all households are eligible. Our counties and our municipalities have administered those programs somewhat individually. So where you live matters for how much funding is available. And the applications have just been overwhelmed. The Adams County agency that was processing and has done a great job trying to look at those applications shut down sometime in October because the requests had far exceeded the millions of dollars they had in funding for that. So one solution to that is understanding the rules around paid leave. There actually are protections both in federal and state law around how to do that. So we really worked with both Department of Labor to have a recorded webinar and how that works. That's available on this Healthy Staffing website, as well as when is it safe for employees to return to work? It's less common now, but early on we had employers wanting dual negative tests, which was this initial CDC protocol. And I can now tell you someone could test positive with COVID for months at a time. and that could prevent them from returning safely to work and again, earning an income and therefore further impacting their financial situation. I think the biggest thing we're trying to recognize with some of this work is, yes, quarantine and isolation is important for community health, but so is people being able to pay their rent, so is people being fed and housed and all of that. Those are all health realities. So just wanted to share some guidance on our website that we found particularly salient and that we've really worked to provide both employers through a business recovery task force and to the people that we work with. And then the other saving grace, which is why Brandy's here today, is we have we've referred to more than this, so please don't. I would forget people if I tried to talk about all the community partners we've worked with. But we've contracted specifically with 6 community partners to do delivery of essential goods, mostly food boxes, and case management services. This is sort of our priority one, because for a lot of our cases, it'll ensure continuity, since someday COVID will go away, hopefully with a vaccine at some point, which is part of my work now. But there are families and individuals who pre-pandemic could have used some support, I think, and the organizations that we have contracted with will exist long after this particular response is over. We also really prioritized since half of our referrals are not English speaking preferred, working with partners that could support those community members. So we've worked with Aurora Community Connection, which is a family resource center. They take a lot of all of our basically Spanish speaking cases who live in Aurora. The Early Childhood Partnership of Adams County, which has a couple of bilingual case managers who work with families in Adams County who are monolingual Spanish speakers. And then the Lovely Spring Institute, which takes what we call our NINS referrals, meaning non-English, non-Spanish. So primarily refugees, but not required to have that status for that. And some of them came on super early in this with us and have taken several hundred of our referrals to date, and are also helping provide that support to our community members. So with that, I wanted to just give you some example of sort of how that's gone on a more on the ground level, and Brandy Kramer is here to give a little bit of her experience with that.
Hello, this is Brandy Kramer, and I'm from Spring Institute. And as Kaitlin said, we're partnering with Tri-County Health on their NINS, or non-English, non-Spanish referrals. And I'll have about 3 or 4 slides to share today. My first one is the economic challenges. And in the first column, you'll see what are kind of the obvious that I think that are the obvious challenges. Also the challenges that at times, and of course, there's never enough resources, but there are resources sometimes available for the things in this column. The second column I'm going to talk about are things that are difficult to find resources to, but absolutely are impacting our COVID positive and all refugees living in that East Colfax neighborhood particularly. The first column, the rent, the mortgage, we're finding people are falling behind on their mortgage. Water bills and electric, so maybe they're able to apply for housing assistance or rent assistance, but it's not covering the water bill or electric. You may have families that came into the pandemic in March that were already a little bit behind, then they missed a few more bills, and so they're very close to getting electric and water bills cut off. Food, kids are at home now. Kids aren't getting their breakfast and lunch at school. Schools have tried and been excellent at having pickup locations for free and reduced lunch, but as you can imagine, transportation is a barrier. And so kids are at home and families are having to, their food bills are increasing. Salary recuperation, when a family has to quarantine, when a family member is positive, chances are someone else in the household could also become positive. So you have maybe 2 to 3 people that were typically contributing to the household bills that are out of work for a couple of weeks. Something to consider with the salary recuperation are there are some people in Colorado that are paid in cash, and it's difficult to, even with if an employer is recuperating those salaries. If you're paid in cash, that's quite difficult. We're seeing lots of car payments that are difficult for families to pay. On the second column, security deposits, I don't know if this was happening pre-pandemic, I can't really speak to that, but what we're finding is, one, if people are moving from an apartment, they don't have the money for the security deposit. We're also finding that security deposits are not being returned to families that are moving. So they rely on those security deposits to be returned to help with the cost of the move and of their first month's rent. And when they don't get that deposit back, that sets them back. Phone bills are huge. Most of the clients that Spring Institute serves, I cannot think of one that has a home phone. All are mobile phones, and they pay month to month. If they miss a month of their phone bill and their phone gets cut off, then especially now more than ever, when you're not able to visit people as easily, you lose contact with families. Also, when people aren't able to pay their phone bills, then their health visits that are being done virtually, any sort of ESL classes that are being done virtually, anything being done virtually is obviously becomes cut off. Car repairs. So car payments was in the first column, but car repairs has been something we hear about quite often when people don't have many times our clients don't have that cushion for when the car breaks down. They've already lost some hours at work. They missed a couple of weeks and now the car doesn't work. Families aren't feeling comfortable taking public transportation right now. They're not feeling comfortable taking RTD. Transportation is a huge challenge. I put parking tickets and towing because that kind of falls under that category, a little bit of the car repairs, in that people have tickets that maybe have stacked up and they're not able to pay those. And then we all know what happens next. The towing I put on here, we've had two families that live in an apartment and are typically away from the apartment during the day because they're working. They were home quarantining and both their cars got towed. So another economic challenge. Laundry, 2 reasons. Maybe families aren't feeling as safe going outside their apartment and doing the laundry outside. And also the cost of laundry. Exterminators, families that are maybe not within an apartment building that exterminates are not able to afford the extermination. We've had this come up a couple of times. And snacks for kids. So kids are home, and one of the staff members that works with Project Shine shared that the kids are saying, "I'm hungry, we don't have food." Before it, and what I think they are saying is, yes, they are hungry. There is food in the neighborhood, and there are food. Hidden Brook has been excellent about supplying a community-wide food distribution, as well as street fraternity, and I'm sure there's others that are in the neighborhood that I'm not calling out. I know that others food deliveries. My computer keeps going to mute. Can you still hear me? Hello?
Yes, we can hear you.
I can hear you.
Okay, right. I don't know why it says I have an unstable internet connection. That's not typical for me. Kids are having to prepare their own food. So I think if any of us have children, you can relate to kids saying there's no food in the house when they're not comfortable cooking what's available. So snacks for kids has definitely been an economic challenge. And I think the kids are kind of eating through that sort of food that's not typical in food deliveries or food distribution programs. Okay, and my next slide, please. These were challenges that didn't really fall under the economic challenge category. Case management has decreased and the needs increase. So some housing organizations are trying to do their case management virtually. Some have decreased their services and However, the need in the community is increasing. As you can imagine, if someone's now eligible for SNAP benefits, or when the extra benefits were added if you had children at home, it was a great addition. However, families that are not as familiar navigating systems need help with that. Another challenge is the isolation of the aging community. The adult daycares, there were, Spring Institute was partnered with 4 ethnic adult daycares. There are many more in the Denver and Denver metro area. Those centers are not open right now. So the aging community is at home. They are not communicating with their friends. They're not socializing or engaging in activities with friends. There aren't very many activities for the aging community. And they tend to, and their use of technology is limited, and their knowledge of technology. So that community is very isolated, as you can imagine. Kids are home and parents are working. That's a challenge in the refugee community as well, as I think, in all of our state, but even more so within the refugee community. Kids aren't receiving the wraparound services from school. So we have youth that are reporting they were seeing a counselor maybe at their school once a week. They were maybe accessing the clothing bank. Their family was accessing the food bank every Friday. Many schools have these wraparound services, and kids aren't receiving those now. Transportation kind of falls under that barrier as well. It's still a huge barrier for kids that are not going to their neighborhood school. In the East Colfax neighborhood, the school that many of those children go to is Place Bridge Academy. And in a car, it's about a 20-minute drive. So accessing their school, re-enrolling is a challenge. I mean, I know DPS is now back to remote, which also leads into things that we've heard kids tell us about remote learning. And I just wanted to share some of the things that I've heard from the kids. My eyes hurt from watching the screen all day. I fall asleep. And the picture that you'll see on this slide, this is a family that's doing remote learning. And maybe you can kind of guess some of the challenges. You may want to add them in the chat box. The challenges that we're hearing from the youth is, one, it's hard for me to do remote learning because my siblings also have their computers going. So headphones and earbuds are necessary for the kids to be able to pay attention to their screen. The other challenge is the internet's not strong enough. The hotspot that we were given is not strong enough, so we have to take turns going to school. Another concern is our youth that are 15 years and older. Our youth that were 15 and in March will be turning 16 soon. They haven't been as engaged in school. It's difficult because of the challenges that I just shared. We're concerned that what the dropout rate will look like for those youth. It's difficult when you, as you can imagine, once you fall behind to get caught up. Physical activity reduction. We have had parents share with us our kids are not able to be as active, and we're noticing that we're seeing an increase in their weight. They're gaining weight. And another is just the inconsistency. This is a challenge of, I think, service providers and of course with the community as well. I don't know how it's avoided, but as things open and as things close and as restrictions open up a little bit, but then they, most recently have become a little more restricting, the consistency of programming becomes difficult. Next slide, please. However, I want to end on a positive note, and this slide is titled "We Can," and these are some examples of things that Spring Institute was able to do in partnership with partners and other community organizations. We definitely have made new partnerships, and there are some organizations that are doing great work out in the community. None of our work has been siloed. It's been through the work of great partnerships. In the first photo, you see a gentleman from the community that's doing a story time for children. These children are not in school. They're not in early childhood education programs, and they're doing an art project and listening to a story. The picture in the middle is a birthday party for a senior in the community. It was done outside and everyone was in a circle 6 feet apart. Obviously, this gentleman seems very happy about his Kansas City Chiefs shirt. He's a Kansas City Chiefs fan. And in that last picture is an activity where youth are tie-dyeing face masks. So I end with "we can," and I think my last slide opens it up for questions.
And you'll get our contact information. Someone had asked me to as well. If you have a resource to share, we have a person on our team that Brandy and I work with, me, Michelle, who has an amazing spreadsheet of all the places we could refer people for any random thing that has been asked by someone or a case manager. Please feel free to reach out via email. I also wanted to do one positive end related to Brandy's, which is on a higher level too. Besides, we get more creative every day and how we try to meet people's needs. There's more and more policy to try and meet, especially what I think we've struggled with the paid leave issue. Colorado has a sick leave policy that passed in the legislature that goes into effect January 1st, 2021. So perhaps maybe even this group could host some thoughts on that. And then, as you all may be aware, paid family leave to start technically in 2024 also just passed in the state of Colorado in the election. And so maybe all of that happens without the pandemic. Maybe it doesn't. I don't know. But if there's silver linings that we're all trying to find, maybe one of them too is there seems to be more collective recognition of that supporting people when they can't be at work for good reasons, so that they stay housed and they stay fed, is impactful in a positive way to the health of both them and our community. So with that, any questions? I do see one in the chat on homelessness in Aurora. I will say we have engaged on that, and the city of Aurora has as well, probably more in the space of the chronically homeless, but they have had some respite shelters and they just announced an additional partnership with the Mile High Behavioral Health. I don't have good details to speak to it well, but they have things coming and more and more. Any other questions? We were just that thorough. So with the slides that I'll share with Bobby Joe, like I said, you'll have our emails. If you have additional resources for the work that we're doing, please send them our way. And we appreciate your time. Any other thoughts, Brandy?
I don't have any more.
Okay, cool.
Before we let you all go, we do want to give an opportunity for the attendees to go around and do community announcements. So if there is anything that you would like to share with the group that you or an organization that you work with are doing, please use this time to share with the group at large.
Hi, I'm Alice Palmatier from Benefits in Action, and we do deliver food to a lot of people, and we need volunteers and we do deliver to Adams and Arapahoe counties. And so if you have anybody that wants to volunteer to make phone calls or drive, we sure could use them. Thank you. I'll put the email and phone number in the chat.
Okay, perfect. And if you have like a flyer or anything, for volunteers, please share that as well.
Hi, everybody. I'm Shirley with Audio Information Network of Colorado. So we provide access to information and newspapers and things like that for individuals that are blind, visually impaired, print disabled, or physically not able to read. We serve the whole state, we serve all ages, but I just want to make everybody aware that one thing that we can do for you is if you do have some kind of public service announcement or just, a free service or something, any kind of information you want to get out there, we are happy to read that information to our listeners for you. So I will put my email in the chat and just reach out to me. As I said, we're happy to provide that service for you guys.
Anybody else have an announcement that they'd like to share with the group? All right. Well, thanks everybody for joining. I know that I learned a lot today, and I hope that you all did too. Please attend our next SDOH meeting, which I think is in 2021. Joe, correct me if I'm wrong. Appreciate you all being here. Hope you have a healthy and safe holiday season, and we'll see you in 2021. Thank you.